It begins in the shadows of antiquity, a silent terror whispered about in ancient texts. We are in Egypt, around 1600 BC. A physician, whose name is lost to the sands of time, meticulously records his observations on a papyrus scroll, a document we would later call the Edwin Smith papyrus. He describes 8 cases of what he calls bulging tumors of the breast. When asked about treatment, his conclusion is chillingly simple and utterly final. There is none. For these afflicted women, there was no hope, only a grim acceptance of a mysterious, fatal ailment. This is the first known written record of breast cancer, a hauntingly familiar portrait of a disease that would perplex and terrify humanity for millennia. It was a malady without a name, a ghost in the machine of the human body, an enemy that could not be fought because it could not be understood. We find ourselves in ancient Greece, the cradle of Western medicine. The great physician Hippocrates, living around 400 BC, observes the same devastating illness. He and his followers developed the theory of humorism, the belief that the body is governed by 4 fluids or humors: blood, phlegm, yellow bile, and black bile. Health, they proposed, was a perfect balance of these humors. Disease was an imbalance. For the hard, unyielding tumors of the breast that did not break open or produce pus, they had a specific culprit: an excess of malaise or black bile. This theory gave the disease a name. In Greek, karkinos means crab or crayfish, a term Hippocrates used to describe the tumor's appearance. The solid, malignant mass, with its swollen, outstretched veins, resembled the shape of a crab, its claws digging tenaciously into the surrounding tissue. The Latin translation of karkinos is cancer. The name stuck. A powerful and frightening metaphor for an illness that latches on and refuses to let go. Hippocrates and his followers, believing the disease was systemic, a result of a body-wide imbalance, advised against any form of surgical intervention. To cut into the tumor, they argued, would only anger it, hasten its spread, and bring about a swifter death. Their recommended treatments were gentle and aimed at restoring humoral balance: diet, rest, and sometimes laxatives to purge the supposed excess black bile. Women continued to suffer and die, their bodies consumed by the crab that medicine could name but could not conquer. The Hippocratic Oath's principle, first, do no harm, became, in the case of breast cancer, a doctrine of inaction, a surrender to the disease's overwhelming power. Centuries pass, the Roman Empire rises and falls. We arrive in the 2nd century AD, where another towering figure in medicine, Galen of Pergamon, dominates the intellectual landscape. A physician to gladiators and emperors, Galen's influence would be absolute for over 1,000 years. He, too, subscribed to the humoral theory, firmly believing that breast cancer was caused by an excess of black bile. However, unlike Hippocrates, Galen was not entirely opposed to surgery, but only in the very earliest stages. He theorized that once the tumor was established, the disease was incurable. His surgical approach, when attempted, was brutal. He advocated for cutting wide and deep, excising not just the tumor, but a significant margin of healthy tissue around it, followed by cauterization, searing the wound with a red-hot iron to stop the bleeding, and he hoped to destroy any remaining disease. The procedure was performed without anesthesia, the patient's screams echoing through the annals of medical history. Galen's teachings, though flawed, were treated as gospel, casting a long, dark shadow over the Middle Ages and stifling any meaningful progress for more than 1,300 years. The world awakens from the Dark Ages into the Renaissance and the Age of Enlightenment. A new spirit of inquiry, a demand for evidence over dogma, begins to challenge the old ways. In the 17th century, the autopsy becomes a more common practice, allowing physicians to see the inner workings of the body and the true nature of disease. The humoral theory begins to crumble. Andreas Vesalius, the father of modern anatomy, dissects human bodies and finds no evidence of the mythical black bile. The foundation of Galen's entire medical system starts to crack. Yet, the old beliefs died hard. many physicians clung to the idea that cancer was a systemic disease, a corruption of the body's fluids. But a new theory was gaining ground, one championed by the Scottish surgeon John Hunter in the late 18th century. He was one of the first to suggest that some cancers were localized and potentially curable if they were removed before they had a chance to spread. He studied the lymphatic system, the network of vessels that drains fluid from tissues, and observed that cancers seemed to travel along these pathways. He proposed that the tumor was the primary disease, not a symptom of a body-wide imbalance. This was a revolutionary concept, shifted the focus from purging imaginary humors to a direct physical assault on the tumor itself. It offered a glimmer of hope. If the enemy was localized, perhaps it could be defeated. The 19th century dawns, and with it, two breakthroughs that will forever change the face of surgery. In 1846, at Massachusetts General Hospital, a dentist named William T.G. Morton demonstrates the use of ether as a surgical anesthetic. The era of screaming, struggling patients held down by strong assistants is over. Surgery can now be slower, more deliberate, more precise. Shortly after, Joseph Lister introduces the principles of antiseptic surgery, using carbolic acid to sterilize instruments and clean wounds, dramatically reducing the terrifying rates of post-operative infection. The operating theater transforms from a place of butchery and death to a sterile environment of healing. These two developments pave the way for the most radical and influential procedure in the history of breast cancer treatment. Enter William Stewart Halsted, a brilliant, daring, and obsessive surgeon at the newly opened Johns Hopkins Hospital. A believer in Hunter's theory of local disease, Halsted took it to its logical and terrifying extreme. Convinced that the only way to cure breast cancer was to remove every possible trace of it, he developed a procedure in 1882 known as the radical mastectomy. It was an incredibly extensive and disfiguring operation. Halsted removed the entire breast, the underlying pectoral muscles of the chest wall, and all the lymph nodes in the armpit. He believed in an orderly, centrifugal spread of cancer from the tumor outwards. His goal was to get ahead of the disease, to create a firebreak that the cancer could not cross. The Halsted radical mastectomy became the gold standard of care for the next 75 years. It was a brutal procedure, leaving women with sunken chests, chronic pain, and debilitating swelling in their arms, a condition known as lymphedema. But for the first time, it seemed to offer a genuine chance of a cure. Survival rates did improve for some women, and Halsted was hailed as a hero. He was a man of science, a perfectionist who had, it seemed, tamed the crab. His procedure was a testament to the belief that more was always better, that the surgeon's knife was the ultimate weapon in this war. The woman's body was the battlefield, and radical disfigurement was considered an acceptable price for survival. But as the 20th century progressed, cracks began to appear in Halsted's fortress. Surgeons noticed that even after the most perfectly executed radical mastectomy, the cancer sometimes returned, appearing in the lungs, the liver, the bones. It became clear that cancer was not always a tidy local problem. It could be a systemic disease from the outset, with microscopic cells or micrometastasis, breaking away from the primary tumor and traveling through the bloodstream to distant parts of Thibody, long before surgery was ever performed. Halsted's orderly centrifugal theory was incomplete. The enemy was more cunning than he had imagined. This realization coincided with the dawn of the atomic age. In 1898, Marie and Pierre Curie discovered radium, a radioactive element that was observed to shrink tumors. This marked the birth of radiation therapy. By the mid-20th century, powerful X-ray machines were developed, allowing doctors to target and kill cancer cells that might have been left behind after surgery. It was the first time a non-surgical treatment could be effectively deployed. Then came the next great revolution: chemotherapy. During World War II, scientists studying the effects of mustard gas noticed that it destroyed rapidly dividing cells, particularly those in the bone marrow and lymph nodes. A physician named Sidney Farber reasoned that this cellular poison might also be effective against the rapidly dividing cells of cancer. In the 1950s and 60s, the first chemotherapy drugs were developed. These powerful systemic treatments could hunt down and kill cancer cells anywhere in the body, addressing the problem of micrometastasis that surgery and radiation could not reach. This new three-pronged approach, surgery, radiation, and chemotherapy, changed everything. It meant that less radical surgery could be just as effective as Halsted's disfiguring procedure, as long as it was combined with these other therapies. In the 1970s and 80s, large-scale clinical trials led by pioneers like Bernard Fisher definitively proved that a lumpectomy, moving only the tumor and a small margin of tissue followed by radiation, was just as effective as a radical mastectomy for many women with early-stage breast cancer. The late 20th century brought an explosion of knowledge at the molecular level. Scientists discovered that breast cancer was not one disease, but many. They identified the estrogen receptor, proving that some cancers were fueled by the body's own hormones. This led to the development of hormonal therapies like tamoxifen, which could block the effects of estrogen and starve the cancer cells. Then came the discovery of the HER2 gene, a gene that, when overexpressed, caused a particularly aggressive form of breast cancer. This discovery led to the creation of targeted therapies like Herceptin, a smart drug that specifically attacks HER2-positive cancer cells, leaving healthy cells unharmed. We had moved from the scalpel to the cell, from crude poisons to precision-guided munitions. Today, the story of breast cancer continues to evolve. We are in the age of genomics, of immunotherapy, of liquid biopsies that can detect cancer from a simple blood draw. The journey from the Edwin Smith papyrus, with its stark declaration of no treatment, to our current arsenal of sophisticated therapies, is one of the greatest sagas in the history of medicine. It is a story of courageous patients who demanded better care, of visionary scientists who challenged dogma, and of a relentless, microscopic enemy that has forced us to become ever more intelligent, more creative, and more hopeful in our fight against it. The crab is not vanquished, but it is cornered. The whispers of fear from ancient Egypt have been replaced by a global chorus of research, resilience, and survival. The war is far from over, but for the first time in human history, it is a war we are beginning to win. If you found this journey through history as fascinating as we did, please hit that like button and subscribe to our channel for more deep dives into the stories that shaped our world. And we want to hear from you. Has this story touched your life in some way? What piece of medical history would you like us to explore next? Let us know in the comments below. Thank you for watching.